Hey everyone, are you finding it tough to keep all those pediatric syndromes straight for your GP-AKT? Don't worry, you're definitely not alone. In this explainer, we're going to cut right through the noise and just focus on the super high-yield facts, the stuff that's really going to help you nail those tricky pattern recognition questions. So let's dive right in.
All right, let's start with a classic AKT-style question. Picture this. A newborn shows up with a cleft palate, small eyes, and extra fingers. Just take a second. What's bubbling up in your mind? What's on your differential? This is exactly the kind of quick pattern recognition you need for the exam, and today we are going to break it all down.
So, here's our game plan. First, we'll talk about how to spot the clinical signs, kind of like a detective. Then, we'll hit the common trisomies. You've got to know these. After that, a rapid-fire round of other key syndromes. Then we'll tackle how to tell the lookalikes apart, and we'll finish up with a simple framework to help you lock it all in.
You know, the AKT isn't just about memorizing endless lists of symptoms. It's really about being a clinical detective, right? It tests whether you can take a handful of seemingly random clues from a vignette and piece them together to figure out the diagnosis. And that is the exact skill we are going to sharpen today.
First up, let's talk about the common trisomies. These are, without a doubt, some of the most frequently tested pediatric syndromes on the AKT. That means having a rock-solid understanding of them is, well, it's pretty much non-negotiable. So let's break them down.
Okay, this slide right here is pure gold. It shows you exactly how to tell Patau and Edwards syndromes apart on exam day. For Patau, that's trisomy 13, you're thinking microcephaly and clefting. But the huge giveaway is polydactyly. You know, those extra fingers or toes? Now contrast that with Edwards, which is trisomy 18. For this one, you're looking for those overlapping fingers and rocker bottom feet. So let's make it super simple. Polydactyly points to Patau. Overlapping fingers point to Edwards. Got it?
All right, ready for a rapid-fire round? We're about to fly through some other key genetic syndromes that you absolutely have to know. Think of these next few slides as your own personal digital flashcards. Let's see how many of these you already recognize.
First on the list, Fragile X. When you see this come up, you need to look for a specific combination. Learning difficulties paired with these physical signs. We're talking a large head, a long face, big ears, and the most distinctive feature of all, macroorchidism. That whole cluster of signs is your classic picture for Fragile X.
Next up, we've got Noonan syndrome. For this one, be on the lookout for a webbed neck, a sunken chest, that's pectus excavatum, and short stature. But the real clincher here, it's the heart. Noonan is very often linked with pulmonary stenosis. So if you're in the exam and you see short stature plus a heart murmur, Noonan syndrome should be right at the top of your list.
Now for Prader-Willi, this one is all about the story over time. As an infant, the baby is often described as really floppy, that's severe hypotonia. But then later in childhood, this completely flips to the feature it's most famous for, that insatiable appetite that leads to obesity. Remembering that two-stage presentation is absolutely how you're going to nail this question.
Okay, let's talk about Williams syndrome. Again, we're seeing some familiar things like short stature and learning difficulties. We've also got some specific clinical clues like high calcium levels in a newborn and a heart issue called supravalvular aortic stenosis. But there's one feature on this list that's so unique it practically screams the diagnosis at you.
And this is it, this cocktail party personality. I mean, if you see a behavioral description in a vignette about a child who is just unusually friendly, super talkative, and not afraid of strangers at all, that is a massive hint. Examiners absolutely love using this because it's such a memorable and distinct part of Williams syndrome.
Next, cri de chat. The name itself, which is French for cry of the cat, gives you the single biggest clue you're gonna get. Of course, there are other features, like microcephaly and widely set eyes, but the presenting complaint is almost always linked to that unique sound the infant makes. And here is that absolute key. The high-pitched, cat-like cry is what we call a pathognomonic sign. Now that's just a fancy way of saying it's a sign so characteristic of a disease that if you see it, the diagnosis is almost certain. So if you read cat-like cry on your exam, you can be very, very confident the answer is cri du chat.
All right, now for a challenge you'll see on the exam and in the real world. In practice, patients don't just walk in with the diagnosis written on their forehead. You see a collection of symptoms, and it's your job to piece it all together. That's exactly why the AKT loves to test your ability to tell similar-looking syndromes apart. Let's look at a classic example.
So here's a perfect pair designed to trip you up. Pierre Robin and Treacher Collins. Both of them can present with micrognathia, a small lower jaw. So how on earth do you tell them apart when the clock is ticking? Well, you look for the family history. Treacher-Collins is autosomal dominant, so if that vignette mentions a parent or another family member with similar facial features, that clue is pointing you directly to Treacher-Collins. It's amazing how often it's just that one sentence that makes all the difference.
Phew, we have covered a lot of ground. So now, let's pull everything together into a simple, actionable framework that you can use during your revision and, more importantly, when you're sitting in that exam hall. Here it is, your 3-step mental checklist for any pediatric syndrome question. Number 1, check the chromosome. Does this fit the pattern for a common trisomy like Patau or Edwards? Number 2, scan for those key physical signs, the really unique pathognomonic features we talked about, like the cat-like cry or the overlapping fingers. And number 3, don't forget the family history. It can be the all-important tiebreaker between two very similar conditions.
So what's the one thing you're going to remember from all this? Is it the cat-like cry of cri du chat? Or maybe the super-friendly personality of Williams syndrome? Just take a moment right now to lock that one detail in your memory. That little bit of active recall is the best way to make sure you'll have it ready to go on exam day. Thanks for joining me, and good luck with your studies.